Thank you so much for allowing me to be here. As you know, and the audience may or may not know, but this is a real passion of mine to really give the strategic overview, and healthcare is changing so quickly. The good news is this presentation changes every single time I try to update it. So, no, it's an honor. I'll give you a quick update. I'm Dana Jacoby, as Mike mentioned. I'm the CEO of Vector Medical Group. Vector was created because I owned a medical market research firm where I did medical market research all over the world. I brought products to market in orthopedics. I brought Botox to China, so I was in aesthetics. I was in a bunch of different ENT and plastic surgery builds. Anyway, long story short, after doing all of this medical market research all over the world, my own business actually was acquired by a private equity firm. And I realized at that time how little I knew. And so decided to make it my mission from that point on to help educate physicians and CEOs about the future of healthcare. And it's been an honor. It's been a real honor. And I think you'll see very quickly from an ASC perspective and just a global perspective how quickly things are changing. So, what I'm going to do today is just give you an overview. We'll start macro and then go to micro. So we'll start with some of the trends. Interestingly enough, the JP Morgan conference was in early January. JP Morgan is where they announce all the latest in healthcare mergers and acquisitions. So some of this stuff, as I just mentioned to Mike, is hot off the press. So really quick, key takeaways so far in 2023. I think everyone probably in this room has heard about the mergers that are happening around healthcare. And I get the question all the time, Dana, is this going to continue? What does this mean for our specialists? The themes that happened this year more robustly than prior years include a lot of Medicare Advantage discussions around the primary care market. You'll see on a couple of slides how quickly that market is changing. But also there is still a ton of dry powder meaning money sitting on the sidelines. So there's not a day that goes by that I'm not in front of a specialty group or even a small hospital health system talking about, is there still an opportunity to do a merger? For our hospital brethren, we're getting a lot of calls from different specialists saying, I'd like to look at my opportunity for the future to partner. And specific to the ASC market, we've seen a lot of these large, broad brush mergers happening where the largest urology roll-up is partnering with USPI to sell their ASCs. We're watching some of the largest orthopedic roll-ups start to consider who their partners might be in the ASC area moving forward. The other major, and again, I'm starting macro, but the other major overlay, and you probably could guess this, but mental and behavioral health platforms going on top of primary care has been a very interesting thing. But long story short, are we going to see this slowdown happen in healthcare mergers? Probably not. In some of the bigger deals, we are watching challenges in being able to kind of do debt recapitalization. But for the most part, it is all systems go. Specific to ortho and specific to surgery specialties, I just frankly, I've never seen anything like it in my career. Pre-COVID, we went from 59% of doctors being employed by a hospital, health system, or private equity-backed venture, and that number is ticking upwards now of 76%. So a lot of change and just a lot of nuance. When you think about the ASC market and what that means for ambulatory surgery centers, a lot of physician groups are obviously investing in their own, but a lot of hospitals are considering, do they need to add ambulatory surgery centers to a broader brush to their outpatient situation because they realize CMS is pushing the patient out into the marketplace. And it's just this interesting crescendo of change. So long story short on the macro trends, continued merger and acquisition activity, continued dry powder. For this group's education, pre-COVID, there was about $1.6 trillion in money sitting on the sidelines, earmarked for, mergers and acquisitions, and with one of the biggest categories being in healthcare. During COVID, that swelled up to 2.4 trillion. It's now back to pre-pandemic levels, but it definitely hasn't changed the slowdown. And there's a lot of reasons for that, but we're watching a lot of really unique changes happen. Most recently, in the primary care sector. So for this group, and I know this is not the group that basically touches a lot of the primary care roll-ups, but just interesting story from a corporate standpoint. Walgreens is now aligned at a large scale with Village MD and Summit Health. The big announcement a couple of days ago, literally, was that Oak Street Health got bought by CVS, and now they're going to be one of the biggest primary care medical advantage or Medicare Advantage roll-ups in the country. I was in one of the largest independent multi-specialty groups a couple of nights ago, and they mentioned to me that Dollar General is now getting into the primary care space. So long story short, anywhere where you can buy toilet paper, you can get primary care services. And I'm being half coy, but it is just very interesting times right now. And what does that mean for ASCs? What does that mean for our specialists? This is what you're going to be playing for from a referral standpoint moving forward. So we're definitely being very close. It's interesting. I have a urology surgical group that actually sold to a private equity a few years ago, and they just got acquired by Village MD, which is Walgreens. So you can see how quickly things are changing in the physician specialty space. So, I'm asked all the time, why is this happening, Dana? Why is this happening now? And we really planned on a lot of these themes from a strategy perspective. We knew that a lot of this was going to change. The average doctor in the United States is over the age of 55. We knew market consolidation was going to happen, but when COVID hit, it really just changed the game almost immediately, where primary care clinics became the place, right? All of us did it. We all decided we could get vaccines in your local, Walgreens or CVS. So it created this massive crescendo of change in the primary care and subspecialty clinic. There is some doctor burnout attached to this. I mean, physicians are saying, hey, I want to practice in an ASC. I may not want to personally guarantee that. How do I go ahead and front that cost for the ASC? And there's private equity money or hospital and health system money to back them up. The couple of things that would affect this demographic, the ASC demographic the most, are one, outpatient clinics tracking outcomes. So, can we get better cost? I heard the surgeon right before I jumped on say, I love my life in ASCs. It's clean, it's quality, I'm loving operating here. We're definitely hearing and seeing the tenor of that, but who's to say we can't continue to move value-based care in that direction and put bundled payments on top of ASCs? We're watching some direct-to-employer discussions happen with ambulatory surgery centers as these groups and as these health systems are getting bigger. Who's to say Walgreens can't partner with, a large orthopedic roll-up can't partner with Walmart, right? So we're watching a lot of those concerns and conversations happen nationally. And people are picking their partners. You're watching Walgreens and CVS decide who they're going to partner with. You're watching Amazon decide who they're going to partner with. So for the surgeon who owns an ASC or who operates in an ASC, you're really in the catbird seat as far as negotiating what this might look like for your future. The question is, honestly, how many ASCs can you build? Because that's quickly becoming the place for outpatient care, not just for private equity-backed ventures, but for hospitals and health systems as well. So I mentioned this, but it truly, the graphic shows, and this is the fascinating part, when you go from 59% of doctors being employed to nearly 75, 76%, there's just a lot of change that happens quickly. And as that change is happening, it's also affecting ambulatory surgery centers. One of my largest private equity surgical backed specialties is building over 10 ASCs in the next year and a half, 2 years. They're seeing that as their opportunity for change. They're also seeing that as their opportunity to control costs, to control quality, and to create more bundles moving forward. So again, a lot of people said, hey, was this just a trend? And we're going to all of a sudden see doctors, not just be selling their practices. Based on the trend line we saw in 2022 and even Q1 of 2023, things just have not slowed down yet. Now, we'll see as we move into the back half of this year if that does change. But for this group and for groups that are attached to this, whether you're a hospital and a health system or an independent medical practice, it really is changing the way that we negotiate payer contracts, the way we negotiate supply chain, but more importantly, the way we negotiate physician alliances and allegiances moving forward. So the hard thing about tracking ASC transactions, and it's interesting, I'm actually in a couple of ASC transactions right now. The challenge is not all the hospitals report when they do a transaction. The specific one I'm involved with that's supposed to close this week, the hospital's not announcing to everybody they're selling their ambulatory surgery center to a private equity. But it's definitely something that we know about. We being those of us that are in the strategy part of the equation. And same thing with physician groups. Not every physician group that's putting a shovel in the sand to develop an ASC is announcing it. So it's really hard to look at the transaction trend of ASCs, but when you look at the volumes of the shift into ASCs and you look at CMS moving payer strategies into ASCs, you definitely can see the volume of change. If you go on things like Becker's, Becker's ASC or Becker's Spine or Becker's Ortho, you can definitely see some of the articles written by some of the folks that are ahead of the ASC delivery mechanism, and you can see quickly how much that is changing. This slide always, and for any of you who've seen me speak before, this slide is always fascinating to me. I literally have to update it almost nightly at this point, but this is just in orthopedics, the number of groups that have sold to private equity. You can see really this starts in 2020 or 2019, and you can see very quickly that we anticipate there'll be upwards of 20 different platforms by mid next year. It's fascinating to see how quickly for the busyness of the slide, but if on my side, the left-hand side of the slide is all the different logos of the groups that have gone ahead and aligned with private equity. On the right-hand side, it shows the date, and then it shows the private equity platform that backs them. But just the number of discussions we're even in after hours, and it's not what you would think, because back in the day, it was dentistry and dermatology and ophthalmology. Now, because of the ASC shift and because of the changes in healthcare, it's cardiology, it's neurosurgery, it's obviously orthopedics, which you can see from this slide. But we anticipate this trend will continue for the larger groups that are doubling down on their independence, or for hospitals that are trying to figure out, are these groups going to leave their system? We watched in Madison, Wisconsin, the entire orthopedic group leave the system and go to private equity. It's really an interesting time. We had a call with a hospital CEO 2 nights ago, and he said, this private equity thing is starting to really affect my region. I'm ready to have an olive branch discussion with the private equity backed platforms. We need to figure out strategic alliances because the us versus them is not going to work anymore. And so what some of the hospital CEOs are deciding is, hey, it's worth it to extend an olive branch and have these conversations outright versus losing the group altogether and dealing with a situation like we had in Madison where the entire group left the health system. So just interesting themes. I will tell you just from being involved with a lot of these groups, I'm always on the doctor side, not on the private equity side. But I anticipate this slide will be another full slide of private equity backed platforms by the end of this year. So it's changing quickly, and our private equity brethren are still sitting on a market amount of cash. So what does that mean for ASCs? For all of you who've seen it, we're definitely seeing procedures shift. We're also seeing, as all these roll-ups happening, and I mentioned this, but some of the largest surgical backed roll-ups are starting to go to the likes of USPI or to the likes of some of their other ASC providers and saying, hey, we might want to think about partnering strategically. We're looking at possible strategic alliances and looking at that long term. The important thing is, like I said, it's not just back in the day, it's not just the orthopedic knee that's moving into the ASC, it's cardiology, it's ENT, believe it or not. We've got a handful of ENT roll-ups happening around the country, and a lot of spine procedures and neurosurgery thinking about what this might mean. But the cardiology theme and the orthopedic theme, those are, from the conversations I'm having, the two hottest specialties where specialists now are trying to figure out in their specific regions or geographies what their livelihood is going to look like moving forward. And you can see pretty quickly, this is just the top ASC alignment providers, but you can see how many, and I wish I had this slide. I need to build it year over year because it almost looks like my physician transaction slide. It is a hockey stick of change of how much these ASC providers are growing and what that looks like. So, from a specialist standpoint, what does that mean? It means that you've got options, right? You have options on who you're going to partner with, for any of you who still independently own an ambulatory surgery center, the multiples are incredibly hot right now. The opportunity to align with local hospitals, with local private equities, with local ASC providers is very interesting. And who's to say? I've got a situation in Portland right now. Amazon, believe it or not, is vying for one of the larger ASC roll-ups in that geography. So, as these large-scale primary care providers get bigger, in Denver, where I sit, Optum owns our largest primary care group. They're now bolting on specialist and downstream opportunities in order to see what their options are moving forward. So, very interesting times. I mean, I think you'll see, if there's anything about this presentation that's fascinating, it's that the crescendo of change is happening quickly. And every group or hospital system CEO that I talk to, my mantra is, how are you going to strategically align yourself for the future? Because that's what it's all going to be about. Not every group is analyzing every situation as far as, hey, do I need to partner with CVS, Walgreens, and Amazon? No. But do you need to look at your, collective geography and decide what that's going to look like, and then start to play for those strategic alliances as far as your ASC is considered? So, why should you even explore a partnership as far as your ambulatory surgery center? But hopefully from the beginning and the middle of this deck, it's kind of a no-brainer, right? It goes without saying, independent ASCs need to find independent alliances or strategic alliances. But for our hospital brethren, the important thing is that you really can look at your respective geography and figure out which specialists you want to partner with and which primary care groups are going to be case in point, front and center in your specific geography. Again, not to go back to my situation where I live, but in Denver, we have Optum playing for our primary, they own our primary care group. Our other largest primary care group is owned by a private equity, and our third primary care group is about to be Village MD Walgreens. So when you think about referral sources in Denver, and I'm definitely not in the most managed care city in the country by any stretch, it's really changing how quickly our doctor groups are having conversations. I was in a specialty group 2 nights ago for their partner meeting, and they said they didn't even know. I mean, they didn't even know the orthopedic groups had sold to one private equity. They didn't know that Walgreens was coming in. I mean, they didn't even know because they were so siloed in their specific specialty. And so we just spent a lot of time looking at their local and regional geography, talking about national trends, and we put together a strategy for how they were going to play in the next 2, 3, 5 years, which I think is a good opportunity for all of us as we continue what this overall roll-up looks like moving forward. The important thing is you've got to make a decision, right? You can transact and stay the course. You can do evaluation and look at what your opportunity cost is for partnering with different entities. The biggest thing outside of just the, pay-to-play CMS or pay-to-play payer situation is also, like I said, for anyone who's operating in an ASC currently, also looking at your largest employer groups that touch your ambulatory surgery center or that touch your system, because those are going to be really important as we look to direct to employer contracts. None of this is easy. I had a conversation this morning with a large Tucson multi-specialty CEO, Tucson, Arizona. And I said, how clean and how well do you track your outcomes with your data? Because if you're going to play for payer contracts, direct to employer contracts, and just frankly, quality of care contracts, you have to have qualified data sets with QA/QC attached to it. And he said, Dana, I'm going to be honest with you, that's not what we have right now. And I said, well, let's get after it. Because if you're going to survive and thrive in the future, that data aggregation and being able to track your outcomes is where it's at. And oh, by the way, that means Dr. A, Dr. B, Dr. C, and Dr. D all need to be thinking about how they're going to follow guidelines and report those outcomes effectively. Easy to say, hard to do, right? But that's going to be a big difference moving forward. So, long story short, and then I'll pause, but what really has been interesting to me as a strategist and I'm literally in front of a different system or different physician group almost nightly at this point, but things are changing and they're changing quickly. And whether it's, they call it the big five. I thought, oh, it's the big accounting firms. And it's like, no, the big five are Amazon, Walgreens, CVS, Dollar General, and Optum. whether it's the big five coming into healthcare or whether it's these big strategic alliances from hospital systems meeting strategics, the payers and the Walgreenses meeting the large scale physician groups that are private equity backed. Our world in healthcare is changing. And it's changing for the good. I think some folks would say it's changing for the negative, but I'm very bullish on the future. I think the bigger piece is folks need to be cognizant, not just of what's happening in the OR, but what's happening in the broader scale geography around you and nationally, because it will dictate how we practice, what clinical guidelines get pushed out, more critically, how we lobby for reimbursement changes. I mean, all of us that are specialists we went to Washington, D.C., and originally the cut was 4.5%. Against the CMS codes, and then it came down, we won the war with 2.5, but 2.5 with the inflation rates isn't a win in my book. So really being able to be conscious and cognizant of these strategic alliances that are happening around us so that we can most productively play for the chess game of the future. And, the way I always, when I mention this to specialists, in one-off meetings in their groups, I feel like if we screw this up, if we screw the architecture of this up, the patient falls through the cracks. And that to me is the sad part. We have to get this architecture right in order to make sure we've got the right strategic alliances to track the right outcomes so that patient care can flourish. And frankly, so our physicians can also be happy. It delights me to no end to hear a doctor in an ASC say that my livelihood is about as happy as it can get. So how do we continue to keep that livelihood at its height, the height of your licensure, the height of your satisfaction, but also at the height of reimbursement for what we need to do with patient care moving forward? So I will pause. That's really the end of my slides. I think I have a couple of minutes if anybody has any questions.